Thanks, Suzanne. Well, hello, and thanks to everyone for taking the time to join today's webinar titled Eco-Anxiety in a Changing Climate. I believe we have a full house today with over 350 people registered, which is an indication of the great interest in this topic. So I want to welcome everyone to the webinar today and to thank Natural Resources Canada and Canada's Climate Change Adaptation Platform for hosting this event. This is part of an ongoing webinar series aimed at sharing the latest adaptation knowledge, tools, and actions across Canada and sectors. Well, my name is Peter Barry, and I'll be the moderator today. I'm a Senior Policy Analyst and Science Advisor at Health Canada's Climate Change and Innovation Bureau. Now, the impacts of climate change on the mental health of Canadians is a significant issue for health authorities across the country, including at Health Canada. We're of course concerned about the possible impacts on populations that might be particularly vulnerable, such as people with pre-existing mental health conditions and the elderly. But we also need to be aware of possible challenges faced by people on the front lines, working hard to prepare for climate change impacts. People like you and I who are supporting research and adaptation efforts. The Health Adapt initiative at Health Canada is assisting 10 local and regional health authorities across Canada to undertake climate change and health assessments and develop adaptation plans. And it's really exciting that a number of them are assessing possible mental health impacts from climate change on individuals. And a few are actually looking at impacts on health systems and health facilities as well. Now, we need to learn more about this issue, and there are a number of knowledge gaps, and so we're really fortunate today to hear from a leading expert examining the mental health impacts of climate change. I've had the great pleasure of working with Dr. Katie Hayes at Health Canada for the last few years and continue to learn from her about this issue. But before I introduce Katie, I'll just go over a few housekeeping items. So most of you are listening to the webinar directly through your computer speakers. However, if you run into any audio issues, you can call into the teleconference line. You can find the teleconference number and participant code at the top left corner under Message from the Host or in the webinar reminder email sent earlier today. And for those of you who do dial into the teleconference line, your lines are automatically muted to avoid any audio distractions. There's also a dedicated Q&A session at the end of the webinar, during which we'll ask Katie to answer questions typed by you into the chat function. But it doesn't mean that you have to hold your questions until then. Please feel free to type out your questions during the presentation in the chat box area on your left. And please ask your questions in the language of your choice. My colleague, Marielle Verret, has kindly agreed to translate any questions for Katie, should that be needed. And I should also mention that we're recording the webinar today, and we'll be sending out a link to everyone who is registered. So with that, I'll introduce Katie and turn it over to her. Katie Hayes is a policy analyst at Health Canada's Climate Change and Innovation Bureau, where she coordinates the Health Adapt program. She's also the lead author for the Mental Health and Climate Change chapter in the upcoming National Climate Change and Health Assessment Report. She completed her PhD at the Dalai Lama School of Public Health at the University of Toronto, where she specialized in public health policy. Her doctoral research explored the mental health consequences of climate change with a specific focus on addressing the inequitable risks and impacts to marginalized groups. Katie has published a number of articles exploring the public health consequences of climate change through a health equity lens. She holds an MA from Royal Roads University in International Communications and a BA in Sociology and Intercultural Education from the University of Victoria. So with that, I'll turn it over to Katie.
Great. Thank you so much, Peter, and thank you everyone on the line for joining me today, as we're going to explore some of the latest research on the mental health consequences of climate change. So today, we'll be looking at the mental health implications of specific climate-related hazards, and then I'll also discuss the latest research on emotional responses to the climate crisis. So we'll navigate the new terminology that is being used to depict emotional responses, terms like eco-anxiety and eco-grief. And I'll be highlighting the disproportionate climate change risks to specific populations, including those who are facing health inequities, and at-risk occupational groups. So we'll also look at the research that describes ways to measure and monitor the mental health consequences of climate change and the role of climate change and health assessment in supporting our understanding of risk, impacts, and adaptation opportunities. And then I'll close with an overview of population-level interventions that support our well-being in a changing climate. And then, as Peter mentioned, we'll leave lots of time for question and answer. So with that, before I take a deep dive into the topic area of the mental health implications of climate change, I'd like to first start with how I'm locating the term mental health. So the term mental health concerns our social, our emotional, and our psychological well-being. Our mental health is reflected in how we think, how we feel, and behave. And mental health not only includes states of being mentally healthy, but also states of experiencing mental challenges and mental ill health outcomes. So the mental health continuum model depicted here on the slide really demonstrates and illustrates that we may be experiencing at different times in our life. We may be excelling in our mental health, we may be thriving. At other points, we might be surviving or struggling or in crisis. And this is a really important perspective of mental health because it reminds us that just like our physical health, our mental health exists on the spectrum. And further, it's really important to reflect that our experiences with our mental health, just like our physical health, are dependent upon our social, biological, and environmental factors. So what I mean by this, for example, is that, experiencing these large public health threats, like for example, the current pandemic or climate change, can affect our overall well-being. And we may already be experiencing additional life stressors, and then on top of that, we're adding these large threats. So the aim of this framing is to suggest that climate change can affect our social, emotional, and psychological well-being in a whole host of complex and complicated ways. So we know that there's some anecdotal evidence of affirmative mental health outcomes from experiencing climate-related hazards that I'm going to talk about in the next few slides. And just as there may be triggered or exacerbated mental ill health outcomes related to exposures to extreme events like forest fires, extreme temperatures, etc. Also, experiences of emotional distress concerning our awareness of climate change, feelings of fear, impending doom, worry, and anxiety and grief, these are typically not pathological. And so what I mean by this is they're not disorders, but rather these are often normal responses to a climate crisis. So this is a point that I'm going to elaborate while we go through this presentation together. So looking specifically at how climate-related hazards affect our health, I really like this image that's brought to us by the 2016 chapter on mental health and the U.S. National Climate Change and Health Assessment. And I've adapted the image a little bit here, and I'll flag where those areas are. But as you can see on the slide on the left-hand side, we have the climate impacts or climate hazards, so things like floods, droughts, wildfires, rising temperatures, melting permafrost, sea level rise. And these hazards disproportionately affect populations already experiencing health inequities in our society. So in particular, those at greatest risk tend to include First Nations, Inuit, and Métis, who have close ties with the land and land-based activities, elderly, children, women, people with pre-existing health conditions, and people living in low socioeconomic status. And I've added this colorful image in the center to highlight that many people experience intersecting health inequities based on social, biological, and environmental factors. So what I mean by this is, for example, that a person living in low socioeconomic circumstances, who is precariously housed perhaps, and they may have a pre-existing health condition, and they've just experienced an extreme flood event. So this person or these groups might be at greater risk for experiencing poor health outcomes, whether it's direct physical health outcomes, including injury, related to poor shelter or protection or not being able to flee an area in time, or from a mental health perspective. So they may be experiencing pre-existing mental health needs that are exacerbated after a significant flooding event, or the event may trigger poor mental health outcomes, like, for example, post-traumatic stress disorder. Another reason that I really like this slide and this imagery here is that it demonstrates the interconnectedness amongst our physical health, our mental health, and our community health. So we know that what affects our physical health often can affect our mental health, and as well there are community health impacts. So where the slide talks about mental health is we see these climate-related hazards affecting these disproportionate populations, and there are particular mental health outcomes that have been found in the research. Things like stress, anxiety, depression, grief, sense of loss. There's also strain on social relationships. There could be a rise in substance misuse, and as I mentioned, things like post-traumatic stress disorder after experiencing an extreme event. This orange bucket here is something that I've added as well because there is some preliminary research and anecdotal evidence that there are affirmative mental health outcomes. And what I mean by this is that there can be experiences of altruism, compassion, communities coming together to support one another in the aftermath of a disaster. And it's really important to capture these outcomes as well to better understand adaptation in a changing climate. And it's also important to note that people may feel a range of responses simultaneously, like a deep sense of grief and loss, and also a sense of community, togetherness, and resilience. So there's a whole host of complicated emotional responses that affect our mental health and well-being.
Katie, I think the screen may not be advancing, or it wasn't for a minute.
Oh, is it advancing now?
Yeah, are you on Pain for the World as normal?
Yes, I sure am. Perfect. Okay. So in this slide, what I want to do is I just want to pause and reflect and say, our broader awareness about and knowledge about climate change. It's important to reflect here that this pain that we might be experiencing is a normal response to the climate crisis. And so what I mean by this is that while there are pathological outcomes or disorders that may occur after experiencing a climate-related hazard, for example, post-traumatic stress after experiencing significant flooding events or hurricanes, there are also non-pathological outcomes, or outcomes that do not lead to specific diagnosable disorders. These outcomes may be normal feelings of grief or anxiety, often termed eco-grief and eco-anxiety, and I'm going to explain these further in the next slide. So what do we mean by eco-anxiety? It can broadly be defined as a feeling of worry, nervousness, concern, often triggered by our awareness of ecological threats facing the Earth due to climate change. It's also been defined by scholars as chronic fear of environmental doom, or the generalized sense that our ecological foundations that form our existence are under threat of collapse. And many of these definitions come from the environmental philosopher Glenn Albrecht. So as you can see, the term is really closely related to worry and fear over our uncertainty for the future. The term has come under recent criticism for appearing to pathologize normal responses to distress, so making something a disorder when it's not a disorder. However, it is important to note that it is not defined by scholars as an official disorder. So you're not going to find the term eco-anxiety in the Diagnostic and Statistic Manual of Mental Disorders that mental health professionals use. Rather, the term is being used to help describe the normal worries and fears people may be experiencing as they bear witness to the climate crisis. And with this in mind, it's important to reflect, the base term, anxiety, has also been defined in a myriad of ways. So it's an emotion, a mental state, and anxiety can also be a disorder. So in some, the term anxiety in and of itself does not indicate a mental health problem. While there are indeed anxiety disorders, anxiety can also be expressed as an emotional response that people may be experiencing to varying levels of intensity. So even at the low intensity range, anxiety is a normal, and it can often be an adaptive response that can help people motivate to act and prepare for future threats. So while eco-anxiety is not a disorder, that does not mean we should overlook interventions to support and help us deal with this complicated emotion. And this is a point I'm going to be making later on in depth as I discuss the latest research and approaches to addressing and supporting well-being in our changing climate. So in particular, when we think of these worries and fears and they become so pervasive, or they're compounded by other life stressors, experiences, or other forms of mental ill health outcomes that affect our ability to function in day-to-day routines, or they lead to harmful behaviors, these experiences can require significant forms of mental health care. And so I'm on slide 9, and I hope it's on everyone else's end as well. So as we navigate this new terminology, there's a whole host of new terms that have come to the forefront that are being used in popular culture increasingly, and they're being debated and researched more specifically in the academic field. So among some of these definitions, I've already gone over eco-anxiety. Closely related term is eco-grief. And so eco-grief can describe these feelings of sadness and lament over our current or impending losses due to climate change. Eco-paralysis is a term that's really used to describe this feeling of not being able to do anything grand enough to address the climate crisis in the time that's required. And another similarly related term is eco-grief, which can be described as a feeling of shame that we may feel as contributors to the climate change problem, whether it's shame over our lifestyles or behaviors that contribute to worsening GHG emissions. And then this last term, which is often less evident, is called Fallostalgia, which is colloquially referred to as feeling homesick in our home environment. So this can also be described as, place-based stress or feeling nostalgic for our environmental surroundings that no longer exist as they did before because of the impacts of climate change. So in summary, these experiences of climate change are wrapped up in feelings of uncertainty about the future, perhaps experiencing or feeling the sense of anticipatory loss and grief, and concerns over how we may have to fundamentally change our behaviors in order to address the issue in a short period of time. So this can feel quite overwhelming. So we may be experiencing significant loss, whether that's a lost sense of place or identity, as our physical locations, our homes, or our work may be impacted by climate change. And for many of us, these feelings are triggered by our awareness that climate change is a real threat, it's progressing and developing, and there's uncertainty about how the issue has been or will be addressed. So, feeling as though there's some fundamental threats to perhaps our systems, our relationships, and our ways of knowing and being in the world. So I'm on slide 10. If it's not moving for you, I think there's a PDF as well on hand. So while we know that specific groups might be attuned to experiencing emotional responses to the climate crisis, it's important to reflect here, as Susan Clayton does in a recent article that she published on climate anxiety, that the range of potential sufferers of these emotional responses can include anyone who knows about climate change. And, given the reach of communications and technology, this could be almost anyone and everyone. So the latest research on emotional responses to climate change, I'm not going to go through this in depth, but just to demonstrate that there's a whole host of research that's looking at our awareness related to climate change and some ways of measuring and monitoring that. So to try and better understand things like climate change distress, climate hope, how we're coping with climate change, and also measuring and monitoring things like climate worry or climate anxiety. And a really brief Coles Notes version of this literature is that the emotional responses to climate change can be identified and measured, and the emotional responses are complex and complicated because we need to consider once again that our health is determined by social, biological, and environmental factors. In other words, our experiences with climate change and climate threats are wrapped up in our pre-existing stressors that we're experiencing, our social locations, our biology, and where we live, work, and play. So I'm on slide 12 for those of you following with the PDF. So just to reiterate this point, experiences with climate change are often exacerbated by our other life stressors and experiences. They're often compounded by experiencing health inequities and systemic injustices. And what the research is demonstrating in the very, very preliminary research on experiences of, eco-anxiety or climate-related worry and anxiety, there appears to be prevalent amongst children and youth and those working on climate change issues and or land-based workers. So while climate anxiety hasn't really been studied well or very in-depth, there's been some recent surveys on the topic area. One example is that the BBC recently commissioned a survey this past March, and they surveyed youth aged 8 to 16. So they captured about 2,000 youth, and they wanted to get an understanding of their experiences of climate change. So what they found is that about 73% were worried about the state of the planet, another 19% had a bad dream about climate change, and 41% indicated a lack of trust in adults to address climate change issues. So children and youth's concern over climate change might be occurring because they're thinking more often about their future. They also have less agency and control in their life because they're reliant on caregivers for their well-being and over their behaviors. They don't often get a chance to say whether they're taking active transportation or the car at such young ages, and they may have more time to focus on the issue. Another group are those who are in the field working on climate change-related issues. And there's some recent findings that suggest that there are experiences of burnout, anxiety, grief, and depression amongst this group who are constantly facing the research, the science, and the predictions on this. And there's also some anecdotal evidence of people leaving their professions related to some of these experiences. So now on slide 13, and we'll soon go to slide 14, because I really want to pause here and say, okay, we now see and can see some of the shape of how the mental health consequences of climate change are taking form. What do we do about it? How do we navigate some of these emotional responses to climate change? So on slide 14, I provide a bit of an overview of a scoping review of the literature that I published in 2019, I believe, with Peter, who's the moderator on this call. And we really wanted to understand, what are some of the factors that can influence our abilities to adapt, to support our mental health in a changing climate. So what we found was that there were, a number of different factors, and we grouped them into these 11 factors that are listed here. And so this is by no means a comprehensive list. It's just kind of a first stab at understanding specific factors that can support our mental health in a changing climate. And these can include things like a sense of community and social capital. So these are two related terms. A sense of community is a feeling of belonging, and social capital is the actual social networks or connections that people have. This came up really frequently, as being very supportive of our mental health in general. And this, of course, seems quite evident when we think of, a lot of the discussion on mental health and loneliness and isolation. It's been highlighted in a number of publications about mental health that loneliness can be as lethal to our health as smoking 15 cigarettes a day. So what this signals is, of course, at our very core, we're social creatures, and we rely on our social connections to maintain our wellness. And of course, this can be challenging in our current situation where we're all physical distancing to slow the spread of COVID-19. But there's still a need to connect virtually to maintain these connections. So in the context of addressing the mental health consequences of climate change, this might mean connecting with peer groups to talk about our experiences of despair or distress over climate change. Some things that are taking shape in many communities are climate cafes, and this was, of course, pre-COVID, where you could go sit in a cafe, perhaps, and have a conversation about some of these emotional responses. There's also virtual opportunities, which I'm going to speak about later on. There's a great website called Eco-Anxious Stories that provides an online platform for this kind of dialogue. So this is important to consider, when we know that the experiences of those who've had or are feeling eco-anxiety, they often highlight that they wish that they had more understanding from social groups and societies around them. And this point was really well made in a recent article that came out about 2 weeks ago by Pala, and I'm probably not saying his name properly, looking at anxiety and the ecological crisis. And he states that, these feelings of anxiety tend to be made worse by socially constructed silence about the issue. So there's a real need to be able to talk about some of these issues peer-to-peer and group settings. Mental health literacy is another factor listed here that is really important. I've discussed earlier, it can help us understand the range of our mental health experiences and how mental health literacy can help, really destigmatize some of the concerns over mental illness. And also, it helps us to better differentiate amongst our normal reactions to abnormal events and some of these pathological disorders, things like post-traumatic stress disorder. There's also a need for healthcare training about the consequences of climate change to our health in general. And this is particularly glaring. I was looking at a recent survey by the International Federation of Medical Students Association, and they found that only 15% of medical students worldwide are taught about climate change. So there appears to be a real need to build this awareness of the health outcomes, including mental health outcomes from climate change. And not only is there a need for healthcare training, but another really important factor that's listed here is culturally relevant care. As I've discussed, we know that climate change is a threat multiplier to those already experiencing health inequities. So really providing a space that is culturally relevant and supportive of mental health as people experience, the additional challenges of experiencing systemic racism and living perhaps in a low socioeconomic status and dealing with a climate-related threat. Another important piece for those seeking access to mental health care to respond to some of their mental health responses to climate change, very important, to have not only the physical access, to mental health care infrastructure, but also financial access, because we know that addressing our mental health needs through formalized care can often come at a financial cost out of pocket for folks. So one of the other components we listed was, of course, government assistance to really support the policies and practice of increasing our mental health awareness, literacy, and also access. So there's also a need for intersectoral collaboration. What's really great is that, looking at the registration list for this webinar in general, we're seeing a whole host of different professionals on the line. And this is what's great about having this type of conversation, because it really requires an all-hands-on-deck approach to dealing with this, with the climate change threat and the health consequences. Another piece here is communication and outreach. So I often belabor this because, as you've seen, one of my degrees is in communication. So it's very important that when we're communicating about the climate change risks and hazards, that we also pair this immediately with messages about what people can do about it. What are the actions that they can take? Because really building that sense of agency is vitally important to feeling as though we can take these protective measures. Because, really, focusing communications solely on the climate-related hazards and risks can either make people disengage completely from the topic area and need to turn off the news, or it can really heighten people's anxieties if they already have, pre-existing anxiety issues. Adding this is another anxious-producing type of piece of information. So again, pairing what we can do about it with those risks becomes a really important consideration. And I'm sure we're all seeing that right now as we deal with the pandemic and the ways that we as the public can slow the spread. Another piece is, of course, community preparedness, and how this can be facilitated often through climate change and health assessment, which is another factor listed here, and it's what I'm going to speak about next on slide 15. So as part of a broader scoping review that I did of the literature, I really wanted to understand, what are the risks and impacts of the mental health consequences of climate change, and how is it being studied? How has it been measured and monitored? Because often what we were seeing was that when folks and communities and groups and organizations were taking on climate change and health assessments, mental health tended to be overlooked. So we wanted to provide a bit of a tool or guidance based on the research and the literature to better understand this. So in this case, we looked specifically at different climate-related hazards. This is just one example here, so looking at extreme weather. And then who tends to be most at risk? What are the population groups of concern? What are some of the potential mental health outcomes that the research has told us about? And how has it been studied? Whether it's looking at conducting surveys after an extreme event, or reviewing patient records for mood and behavioral disorders, or monitoring emergency department visits, or reviewing new prescription use after an extreme event, often seeing a rise in perhaps anti-anxiety medications, and also conducting interviews. And so in this piece, this publication that we worked on, we looked at, also what are the climate-related mental health outcomes of drought, and also of climate change writ large, amongst a whole host of other hazards. So now let us focus on coping, with these experiences of climate change. For many folks, activism or action to address the climate change problem may be highly supportive. Doing something about the issue whether it's engaging in personal climate change mitigation efforts, whether it's pressuring decision makers to act or speaking out about the issues. This may help people feel as though they have some form of agency or control over the issue, of addressing the issue. And for some, this may provide a sense of meaning or purpose or hope in their lives. Often the reports of Greta and her work has been that it's been something really meaningful to challenge some of her challenging experiences. And these behaviors tend to be done in groups, whether it's a virtual group now, and these social connections, just as I mentioned earlier, are in general very supportive of our mental health and well-being. But I do want to pause there because oftentimes what has been touted is that action is the antidote to anxiety. And that's not necessarily the case. There's really no one-size-fits-all approach to addressing our emotional responses to climate change. If we think about someone who has, really done a lot of actions and activism and they're trying to sustain this, but for some it may lead to burnout. And as we discussed earlier, it could lead to, this feeling of eco-paralysis, or feeling like, we keep trying, but the actions don't feel big enough or fast enough to address the magnitude of the issue. And, for some, constantly reading the research and the news about it can be overstimulating, and, we might feel bombarded by the barrage of bad news. And this can, perhaps lead us to turn away from this type of content, to limit this type of content, or maybe to be very picky about where we receive our content from trusted sources. So for this reason, again, I just, highlight there's really no one size fits all to dealing with our emotional responses, because the issues are complex and we're all coming at it with our own life stressors and experiences and networks of dealing with this. So it might mean taking time out to address our individual mental health needs, finding supportive mechanisms to address state of struggling or crisis that we may be in, going back to that earlier slide I talked about in terms of, our mental health continuum. And this may mean seeking formal mental health care from professionals or community-based mental health care or self-care. Again, always thinking about those factors that can contribute to access. And as I discussed, our mental health needs are complex. We're dealing with tons of life stressors and experiences that are exacerbated by these public health threats. So supporting our mental health, might mean cultivating connections with our natural environment. So often, what's called nature-based solutions, whether it's getting involved in a conservation group, whether it's planting trees, or whether it's tending to our garden or reconnecting with our natural environment. Again, when we talk about connections and how important and vital they are to our mental health, it's not only social connections, but connections to the natural world as well. There are also, a lot of ways that people are processing the deep meaning or the deep emotional processing of grief and anxiety that can come up. And for many, this might mean, mindfulness-based approaches. There's many of them out there right now, premised on reconnecting with the natural world, being present, finding meaning or purpose in one's life. And these approaches might help us rekindle or spur some of those climate actions to really get us out of those feelings of eco-paralysis. But I can't belabor it again enough that it really is going to be dependent on everyone individual and their experiences. Now we're on slide 18, and we're looking at community-based care. So this was a piece that I wrote with a few of my co-authors for Yes Magazine a few years ago. And we looked at 5 kind of community-based approaches to dealing with, population-level threats related to climate hazards. And I'm not going to speak to all of them, but 2 related examples. One from the U.S., which was called Reach NOLA, which is a mental health infrastructure and training program that was created after Hurricane Katrina in New Orleans. And so this program targeted one of the hardest hit communities, which is the lower 9th Ward, which is a predominantly Black, low socioeconomic neighborhood. And this program included education and workshops about depression and the potential for mental health effects after disaster. The aim was also to dispel pervasive stigma about mental illness and trying to open up that conversation to talk about our mental health needs. And the program also included the training of residents who lived in the neighborhood, and they were trained in mental health first aid and they were later employed as community health workers to serve in that neighborhood. A similar example in a Canadian context is in High River, Alberta. And so for those of you who may remember, High River experienced the devastating 2013 flood, where residents were displaced from their homes for months and even years on end. And this is where my study came in. I looked at the long-term mental health implications of the High River flood 5 years after experiencing it. And so noting that there were long-term implications of community-level anxiety over the flooding event and over impending events, worried that this would happen again. And this general anxiety in the community, they established what was called the Safe Spot campaign. So members of local businesses were trained in psychological first aid. And so once they received this training, they posted a big orange dot on their business door. So you could see a local coffee shop or hairdresser or your bank with a big orange dot on the business. And the aim is to highlight that any door is the right door when we're seeking support for our well-being. And this is particularly important in a rural community where there still may be the pervasive, not wanting to speak to a mental health care practitioner because maybe you know that person, or maybe you don't want to go into that business because everyone in the community may see you doing this. So it was really to kind of open up the community level dialogue and really build that mental health literacy and mental health care. So now we're on slide 19, and we're still doing decent for time because I'm going to make sure I leave lots of room for questions, and I only have 3 more slides left. So what I want to talk about here is in thinking about community, thinking about community-based care, thinking about health inequities and those who are most at risk, it's really important for us to learn from and with those on the front lines experiencing the devastating effects of climate change. And it's also important to reflect that many frontline communities are those leading actions to address climate change. So not taking this deficit-based approach, not saying, what are the vulnerable populations at risk? It's, what are the populations who are at risk? What can we learn from them? How have they been agents of change? What are the other areas that can be supportive in really addressing, not only the climate-related hazards, but systemic injustices that kind of create this threat multiplier in and of itself. And so, really kind of changing the language of vulnerability, really focused on co-creating the research and on co-creating the solutions. And so this is something that I highlight in the Mental Health and Climate Change project that I worked on last year, I believe, looking at specific groups, women, youth, and newcomers, and highlighting some really great projects that are taking place, like the Yukon Indigenous Community Climate Change Champion Project, which really builds youth leadership in dealing with climate change-related issues. So now we are on novel approaches, and I'm hoping that you can all hyperlink to many of these great resources here. Again, this is not meant to be a full exhaustive list of types of approaches, but again, just kind of some of the pieces that I've come across in my research, and I'm sure there's tons more that are developing. So please feel free to reach out with those and send them to me, because I always like to provide kind of an overview of what's current and what's out there. So some really interesting approaches. One is social environmental prescribing. So social prescribing has come up kind of as an approach to really supporting social, emotional, mental, and physical health. And the example that I'm providing here is from the New York University Environmental Health Clinic. And to the best of my knowledge, it no longer exists, which I think is a shame, because it's a really great example. So what happened is the New York University, we're seeing a lot of their students coming in, talking about their stresses, fears, anxieties over the climate change threat. And so what they did is they set up this environmental health clinic and brought in the students who were really feeling a lot of the stress, and prescribed them with actions. So actions that they could take based on their skills, experiences, specific needs to address the climate change problem. There's also things like networks of care. So from a specifically mental health perspective, there's the Climate Psychiatry Alliance, which was founded in the U.S., and it has a startup group in Canada as well, and I believe there's a similar group in the UK. And really, this is a network of mental health professionals coming to talk about the issues that they're experiencing, the things that they're seeing in their client base and their awareness about things like anxiety related to climate change, worry, excessive fear over these things. There's also training programs. So there's the International Transformation Resilience Coalition workshops, where you can go and do workshops, often based in kind of mindfulness-based techniques of presencing and being with the challenging experiences that we're having and finding ways at a community level to support and act. There's guidance documents. For example, there's an emotional resilience toolkit for climate work, and I've used this in the past before, and this is with students. And this is a really nice resource, if you're working in the field, if you're a climate scientist or you're, a school group, what have you. They provide some really neat exercises that can be done within 20 minutes, 30 minutes, a whole day workshop. And it's a work in progress as well. So, getting more information from folks who've used it or other tools and tips and tricks. And of course, there are nature-based therapies. And this has existed for decades in Japan. Things like forest bathing, which is, again, about presencing and being with our natural environment, creating that sense of connectedness, appreciation, which tends to then prompt us to care for, respect, conserve, and protect our natural environment. There are a whole host of group-based interventions. As I mentioned, climate cafes is a common one. I won't go through all of these, but there's some links to some of those. There are also spiritually based interventions. As I mentioned before, many are taking a mindfulness-based approach to working through deep grief and then prompting some form of action. And there are online forums. As I mentioned, Eco-Anxious Stories is another great way of, it's an online platform that you can go and write your stories about feeling this sense of anxiety. They offer, I believe, podcasts and different presentations and different resources there. And Jen Dredd, which is a new publication by Britt Bly, where she's looking at a lot of the same topics that we've talked about today in depth, talking to different experts in the field and providing snapshots of what this means and trying to get this more into the public discourse. And with that, I want to say a hearty thank you for everyone who's joining and who's on the call. And I'm going to pass the floor back over to Peter so that we can open it up for Q&A. Thank you.
Wonderful. Thanks so much, Katie, for the presentation. I think we've got almost 20 minutes for questions and answers. It's been some really interesting discussion and questions posed. I do apologize to people in terms of some of the slides, but you do have the PDFs, so you have those with you. So, Katie, the first question is for you. Is it possible to be excelling and also experiencing deep grieving with respect to climate change?
Yes. So deep grieving, so there's a lot of really interesting work that's kind of coming to bear. Joanna Macy has some really great work on active hope and the work that reconnects that talks about our experiences of deep grief with acknowledging our awareness or our experiences and exposure to the climate threat. And often, what we want to do with grief is we don't want to feel it because it's not a great feeling to have. And so a lot of the literature that Joanna Macy talks about is really how to move through that deep grief, confronting that deep grief, a lot of awareness and tools of gaining support in our networks and finding ways that work for each one of us to deal with that grief. Because again, grief in and of itself is going to be something that requires a whole host of tools for folks to deal with, whether it's mental health professionals or social support groups. And I'm not a mental health practitioner, so I'm not going to provide any tips or tricks there. But indeed, this deep grieving, there's lots of conversation about moving through this deep grieving and getting perhaps to a state of active hope, which is what Joanna Macy talks a lot about in her work on the work that reconnects, is recognizing, acknowledging this grief, and then working towards a state of optimism and hope. And again, this isn't, a linear process. It's not a quick and easy 10-step guide how to get there, but rather a broader conversation about how to work through that. Thanks for the question.
Yeah, no, thanks so much, Katie. We've got another question in terms of the role of nature-based solutions in supporting mental health and climate change issues, and related to that, how can land or water-based activities be used to alleviate eco-anxiety? Is there any specific research or examples?
Yeah, so there is the research base is growing here, and much of it comes from looking at some urban planning and greening environments, and making sure that people have access to green space and access to nature. And what they've seen is that demonstrates enhanced mood, lower levels of anxiety, increased overall wellness. When we think about it as well, when we have access to water or land and nature-based areas, it can also improve our physical health. Of course, if we want to use more active forms of transportation or walking or biking or feeling safe in these environments, that also improves our mental health and well-being. So yes, indeed, in terms of nature-based solutions, accessing our natural wonders has been a form of deep solace for, deep growth for many people in terms of dealing with their anxiety. Because again, it fosters that sense of connection that's really vital and important, because we start to, grow our awareness and our concern for environment. It can then often relate to pro-environmental behaviors, like wanting to protect or conserve our natural environment. Thanks, Peter.
Well, thanks for that. Another, question. There was a discussion point about storytelling as being. It was great to have that recognized in your presentation. Which leads to the question about how knowledge of climate change impacts on mental health might help us with communicating climate change and increasing sort of behaviors in terms of adaptation and things. If you can speak to that?
Yeah, absolutely. Yeah, there's such an important element of storytelling. Again, it connects us to our heart and heads as well, and provides us with an outlet to really work through some of the difficult emotions that we may be experiencing, helping us to provide the language around what we might be feeling. And I think it is really important to understand the mental health consequences of climate change, just as I mentioned earlier, is that, this can help with our messaging, because, we've heard lots of the alarming messaging, so much of the dire predictions, and when we read the climate science and we read the research, it's often, we're not talking about something that's necessarily positive right now. And so we really need to understand, how is that being received, and what are people doing with that information? And just kind of going to that point of when we're receiving or when we're targeting these messages, is that we're not just kind of belaboring the alarm bells and leaving that with people to figure out what to do, but rather definitely ringing the alarm bells. We need to know what is going on. We need to be alarmed by this issue. But what are the actions that we can take? And oftentimes we really need to be targeted. Who are we speaking to? If we're speaking to a youth audience, if we're speaking to children, what are the actions that they can take? If we're speaking to families, what you can do as families. If we're speaking to the broader public, what are the actions that every household can take? What are the actions that groups can take? What are the actions that are tangible and often easy to do? We're seeing a lot of that right now in the current pandemic, making sure that we understand what the threat is, and then what are the easy steps we can do? Wash our hands, wear our mask, and maintain that social distancing. 3 easy messages, and really bringing that to bear in our conversations and in our communications about climate change, so that people can really understand and work with that information in such a way that the actions seem feasible.
Great, thanks for that. And it's a question about the relationship with COVID-19. So how do we, or can we detangle the mental health effects of COVID-19 from climate change effects? Does it make sense to try to do so for the purposes of research? And I guess from my perspective, thinking about doing climate change and health assessments, do you have any thoughts on that, Katie?
Yeah, and this is kind of taking a step back. This is one of the challenges of studying mental health and climate change in general, because, trying to assess the specific mental health implications of experiencing climate change are difficult, just as I've mentioned before, because our mental health needs and our mental health in general is complicated by our life stressors and other experiences that we're having, and our social location and our biology and our environment. And so, parsing out the mental health implications of climate change from the mental health implications of COVID is very difficult because we're experiencing them simultaneously right now. And so, and they're both these large existential threats. And there's some similarities in that vein as well, in that there's uncertainty about our future. There's questions about how we act and what types of actions that we can take. The research is evolving in both subject areas. So again, I think it's just really important that we recognize and have these broader conversations about the mental health implications of these large public health threats, and to do them in tandem, because right now we're very much dealing at the forefront with COVID-19, but we're also in many communities dealing with the climate-related hazards, and we will continue to deal with both. So, skilling up and understanding what those mental health implications are and what the resources are to support us is going to help us in the long run as we deal with this. It's often been framed that COVID is the dress rehearsal for the issue of climate change. And so I think in this time, what we can really do is create a better understanding and awareness of the resources that are there to support us and what needs to be developed and the research that needs to be done to support us well into the future.
Great. Thanks very much. It's interesting. There's actually three questions that are really directly related. So I'm gonna try and ask you them all at once, but I'll.
Okay. I'm in the hot seat.
So, what would be the goal of mental health treatment in the climate change context? And so, why is it desirable to eliminate eco-anxiety? And then the related one is, can eco-anxiety actually be harnessed as an asset for climate change action? So they're all kind of related there.
Yeah, and so this is where it's really important, I guess, to understand there's so many nuances to these terms, eco-anxiety or anxiety in general. So just as I mentioned earlier, many of us may be experiencing anxiety at different levels of intensity. So, for example, if our low range level of intensity of feeling this eco-anxiety prompts us towards action, and that's supportive, and that's not furthering burnout or distress or depression or what have you, then yeah, it can be really a supportive action to take and can indeed be that motivational factor. Just as I mentioned, anxiety in and of itself is not pathological, and anxiety is often, helps us with our fight, flight, freeze. And so in that case, at the low range of levels, then of course there can be ways that it is supportive. The issue is that because eco-anxiety and anxiety in general and how it's conceptualized and experienced can be different for everyone. And so if, we're seeing a lot of ill health outcomes, the anxiety is so much so that you're leading towards burnout, or it's complicated by other mental health factors or other experiences, action is not going to be the supportive intervention that may address that. So for some people, it is going to need to be seeking mental health care, whether that's, formal mental health care from a mental health practitioner, or whether that's maintaining, sustaining, building community connections, whether it's, self-care approaches. There's a whole host of tools that, mental health practitioners can provide to really support people who might be experiencing, more of that, those challenging crisis mode forms of anxiety that need to be addressed. And of course, it's really going to require that people, that we have this larger conversation about these differing levels, and also that we build awareness, research, and understanding of what this all means. Because again, there's no one-size-fits-all solution because of the complexity of the issue for each individual.
Thanks, Katie. And a fairly specific question in terms of, would you have a specific recommendation for a workshop guidance tool that would be, used to keep staff working on adaptation or climate change issues motivated moving forward?
Yeah, so I'm just going back to the slide 20 for folks. So yeah. Guidance is highlighted there. That emotional resilience toolkit for climate work, and it's to the best of my knowledge, it's the only specific emotional resilience toolkit directly targeted for climate work. If anyone knows of any others, please type it in the chat or send me an email, because I'd love to read more about it. But that is a really neat resource, and as I mentioned, it's evolving. So I believe it came out last October, so it's almost a year old. But the author, whose name has now escaped me, has kind of said, please use this, give me feedback, tell me what it's like. So in my experience, I've used this with university students, and we did it virtually. So again, this can be adapted to a virtual context, and this was pre-COVID. We adapted it virtually, and it was quite a successful way of engaging, and I think we did 2 or 3 of the exercises, and I believe there's like 18 to 20 exercises in there, and it really is, there's different ways, what are your objectives, number one, and then you can kind of look at each tool and see what will then work for that group. Sometimes it's, facilitating climate cafes, which is, having just this open conversation. You're not trying to get solutions, but maybe we're just trying to talk about how, the work that, climate scientists that we're working on, this can be depressing. It can be difficult work to do, and how do we, as members of our work community, how do we work together and really address this while we're still working on all these climate-related solutions?
Great, thanks, Katie. I probably have time for a couple of more questions for you. There's no shortage of questions after your presentation.
I'm seeing lots in the type chat, and there's one actually. I'm just going to follow up on my last response about how do we deal with eco-anxiety, because I see one of the questions is how do we seek mental health care when eco-anxiety is not recognized in the DSM, which is the DSM, for those on the line, is the Diagnostic and Statistic Manual used by mental health practitioners and professionals. So what's interesting, and while I have the slide up, is this network of care, the Climate Psychiatry Alliance. I'm going to try and use the arrow function. Here we go, on slide 20. The Climate Psychiatry Alliance is an alliance based in the U.S. As I mentioned, there's a Canadian section that's being developed as well. Are mental health practitioners that are well informed about things like eco-anxiety, and so they still have tools and tips and tricks to support people. So again, even though it's not a diagnosable disorder, but there are still interventions taking shape to be supportive for folks. So just wanted to add that.
Okay, great, thanks. And another question is, are different aspects of anxiety or mental health linked to specific agents of climate change? So perhaps meaning specific hazards or drivers or components of climate change.
Yes, sorry, you're echoing there, Peter. But I think I'm going to go back and I'm echoing now. I'm sorry for those of you on the line.
Hi, if anybody has unmuted their line, please mute it again if you're on the conference call line. Thanks. It's *6 to remute it.
Thanks, Suzanne. So again, are there specific outcomes related to specific hazards versus climate change writ large? So as I mentioned earlier, I'm just looking at slide 6 right now, which looks at, the climate hazards, things like experiencing wildfires and flooding events and hurricanes, these extreme events that are often called extreme events. What the research demonstrates is that, we often see cases of post-traumatic stress disorder after experiencing this. We often see heightened anxiety and depression. And much of this research comes from the disaster mental health research. And when we look at, layering the conversation around climate change, what we also start to see for those who've experienced these hazards, like a flood, for example, is anticipatory grief or pre-traumatic stress for those who are anxious that a similar event is going to happen again. So for example, in my research in High River, where I looked at the long-term mental health implications of the flood, that was often what people were expressing, was that they continue to have an eye to the sky. They continue to look at the flood level waters. They continue to be, read all of the weather reports, really get anxious during the springtime when there could be the risk of another major flooding event. And so there's often this kind of anxiety that comes around that. When we think of things like drought, for example, drought can often have a lot of different mental health consequences, psychosocial health consequences, community health consequences, because of course, during pervasive drought, what that does is it affects our food supply, right? It affects obviously food and water supply. And what that can do is it can be very significant for farmers and obviously people who are feeding their families because the resources are scarce. And that may lead to things like interpersonal aggression because resources have become scarce. It could lead to displacement and migration because the land is not fertile enough to deal with. And so that has strains on our social relationships, on our work where we live. Extreme temperatures, for example, the research on extreme temperatures. In heat waves, there's been reports of emergency department visits for increased mood and behavioral disorders. There's research as well that demonstrates that those with psychosis who experience extreme heat events are also greater risk for experiencing poor mental health outcomes related to psychosis. There's also, considerations for those with mental health issues, particularly for those who are taking psychotropic medications, that the medications can interact with extreme heat. So again, recognizing that, there are specific populations most at risk. And so those are just some of the climate-related hazards and the potential mental health outcomes. And then, as I mentioned, what much we've talked about today was our awareness and understanding of climate change to these larger emotional consequences, things like what's been termed eco-anxiety or eco-grief. So thanks, Peter.
Yeah, no, thanks so much, Katie. So I think that brings us to the end of the webinar. I see that Suzanne has indicated in the chat box that if people could take a few minutes to fill out the webinar survey, that would be really quite helpful. And there's information about where to view the recordings as well. So I just want to thank everybody for joining today. Really hope you enjoyed it and found it of interest. And a big thanks to Katie for her presentation, and to Suzanne, and also Suzanne from the Climate Risk Institute, and to Adam Greenberg from NRCan for supporting the webinar. And so you'll see the last slide there, information about Canada's climate change adaptation platform webinars and the platform itself. So thanks to everybody, and I really hope you enjoy the rest of your day. Thanks so much.